Welcome to BofC Live, the daily video and podcast series of Business of Cannabis. BofC Live highlights the company's brands, people, and trends driving the global cannabis sector. Learn more at businessofcannabis.ca. On today's BofC Live, we're joined by Sherry Boodram, the CEO of CannDelta, the official regulatory advisory of Business of Cannabis, talking all things cannabis health products. Sherry Boodram, thanks for being here so early on a Monday morning.
Thank you for having me.
It's good to see you, first of all, but also I wanted to check in because I'm an avid reader of cannabis Twitter. And then I saw an update about cannabis health products that maybe Health Canada put out, which called back some conversations we've had with you guys over the past, 6 or 8 months. So is anything happening with CHPs? Well, let's call them CHPs, cannabis health products, or is just like an update that we should know about?
It's always, there's always updates that you should know about. It's really nothing too new, I would say, that's happening that, there hasn't been information that's circulated the web prior to this there was a recent, sort of publication on Health Canada's website, I guess it was last week, the beginning of February. Basically just reiterating Health Canada's commitment to including cannabis health products in its agenda, its upcoming initiatives for the next couple of years. So just to frame it, cannabis health products, or CHPs, actually interesting, point is that Health Canada is still trying to decide on what they want to call it, either cannabis health products or health products containing cannabis.
Right. So. And well, it's even longer than that. It's like health products containing cannabis that don't require,
oversight from a healthcare practitioner.
That might be a little long. There's probably not even a sleek acronym for that.
I like CHPs, like cannabis health products. I think that has a nice ring to it. So we'll stick with that for the purpose of this conversation.
Fair enough.
So CHPs are a proposed category of cannabis products that, as we were saying, it could have a medical, like a therapeutic claim to it, but interestingly, it doesn't require healthcare practitioner oversight, so which means that it doesn't need a prescription. So currently, we have, sort of two categories. We have, the cannabis products that we know very well in the recreational market and the medical market, where it's, cannabis products that are sold in either retail stores or through federal licensed producers that have a medical sales for medical purposes license, and that's directly to medical patients. And then we have drugs containing cannabis, which are cannabis products that have safety and efficacy data to support it, and it goes through market authorization, has a drug identification number. You need a prescription for it. There's physician oversight, and that's typically produced largely by pharmaceutical companies, like products like Sativex, for example. So those are the two categories. So CHPs fall somewhere in between that area. So it's quite a neat category, I would say.
And so right now they don't exist. Well, they exist. They don't exist here, I guess. Is probably a more likely thing.
Or legally.
Right. Well, that's true too. Right. That's true. And so the, Health Canada set out a group of science advisors. Is that the right term? Who've looked at this, and is there a timeline when they're considering it, or they're just said we're going to consider it?
Yeah. So because there's a medical, there's health claims that are proposed to be associated with these products, their approach to rolling out the products will fall under an evidence-based approach. So they need evidence in order to substantiate the use of these products, the safety of the products, the efficacy. So there is a hybrid of that particular product where it's similar to prescription drugs, but sort of at a lesser degree, if that's sort of a safe word to say.
Yeah.
But the thing is, if there's going to be still evidence, but maybe less evidence, Health Canada needs to know exactly what is that limit of safe enough evidence where you could carry out the evidence, submit it to Health Canada. Health Canada will say, okay, this is an acceptable degree of safety and efficacy and quality data in order to approve these types of products. So in order to understand that, Health Canada needed to put together and establish a scientific advisory committee, which is largely based on it was an open nomination for this particular committee. The open nominations were actually last spring. They extended it a bit because of COVID, but they finalized the nominations around May or so. So it's composed of 10 individuals. The requirements were that they had, a university background. Largely, they were accepting people with doctorates, so a PhD or in the medical profession, either as a physician or a veterinarian. So they had specific specialties in the area of ideally cannabis and the uses or potential effects of cannabis on certain populations or indications. So they had that expertise that they could bring to the committee and be able to sort of evaluate what would be the best approach of rolling out these products. So their first meeting was actually November 2nd and 3rd of last year. That's kind of when they very high level kind of went through what their terms of reference was for their committee, the mandate, and all of that. And then they had a follow-up meeting at the end of November, beginning of December, where they went over what the current landscape is for cannabis, for pharmaceutical drugs, for veterinarian products, and then sort of did a deeper dive into some of the evidence that currently exists. So I actually had a call with the acting director of the policy department there, who kind of heads up the committee, and he was basically saying that they do have 1 year from the date of the committee's establishment to provide their feedback to Health Canada on their findings, their advice. And so I mean it's roughly 1 year, so that would be this fall. They should have some information to be able to provide to Health Canada and hopefully to the public on some of the recommendations and advice that they have for rolling that out, and then kind of goes from there to see okay, what's Health Canada going to do in terms of drafting actual policy and legislation, and sort of going up the chain with that. So the notice that came out last week or on Health Canada's website, reiterating the fact that they are committed to the review and sort of establishing a framework for cannabis health products. That's something that's still within their agenda, and they're still working towards establishing that commitment, which really came out of the consultations when they were reviewing the proposed regulations for the Cannabis Act and the Cannabis Regs. So this is direct feedback that came back from those earlier consultations that the government, even though they didn't include it in the current act and regulations, they recognized that this is something that was of value and needed by the public, requested by the public, and they were still committed to figuring out a way of how are they going to implement that, and just needed some more time, and that's why we're kind of seeing this delay now.
Okay. So like in your mind, when you think about this, and you talk to both your Health Canada contacts, but also the industry overall and your clients, and it's obviously not imminent, right? That's part of it, but also sort of long-term. Speak to me like I'm an 8-year-old, which is sort of how I like to be treated. But like in your mind, is this something that at some point, a cannabis health product is in like the vitamin aisle type of thing? That's like between vitamin C and vitamin D, there's like CBD capsules, like in that same aisle next to all the other Jameson products?
I mean, there's a lot of interesting conversation about that. So what Health Canada was proposing was that it would be sold in cannabis retail stores, so what you currently see, and then through federal producers who have medical sales licenses, so directly mailed, to a medical patient. So that was a framework. Through the consultation feedback, there was a lot of push for having it in like pharmacies or being sold at pet stores for animals. So I mean and the reason behind that was as stated through the summary document from the consultation, was that they want it to be more accessible, obviously, but also to normalize cannabis and remove that stigma, which is interesting because Health Canada, if you read the actual consultation document, they they sort of didn't want to normalize cannabis
Right.
for that reason.
Right.
So they actually said they didn't want to normalize cannabis, and that's why they wanted it to be. And obviously they still need to meet the objectives of the Cannabis Act by ensuring the safety of young people and protecting youth and all that. So those are the reasons behind having it in areas that are age gated and things like that. But at the same time, cannabis health products are supposed to address indications that are broader. Let's say, to ailments for pain or for sleep or for anxiety. So it's sort of, they call it lower risk sort of, therapeutic uses for cannabis health products. And that's where that's sort of the purpose of having cannabis health products.
Yeah.
So, and why it would be okay not to have physician oversight. And some of the arguments in the consultation that came out of the consultation was that if we sell it in cannabis retail stores, those bud tenders may not be versed enough in healthcare to be able to provide information on these healthcare products. Like, and that's
Right.
that's a real fact. Whereas a pharmacist can.
Right. And then you say, well, okay, well, maybe then you can put it on the label, but they can't even get the containers. It's like, there's so much to it. It is interesting. I would love to fast forward 2 years from now when we know sort of what the science advisory committee, what the consultation said, how that folds into the sort of current framework, and then start predicting or projecting what that means for the sector overall, what it means for non-cannabis retail stores, and how they will welcome this in. But obviously we have lots of time to talk about that, because we could project about that for certainly the next, I don't know, 8-9 months, and then beyond that as well. This has been really helpful, though, to put the sort of cannabis health product, not even timeline, but like why, what we're doing now, what will happen in the future. Because I think it is, look, timeline notwithstanding, it is exciting to think about sort of a new category of products in the sector.
Right. Yeah, no, definitely. It's definitely exciting. It's necessary. There's obviously a big, push for CBD products, especially in, market sizes or populations that are not normally cannabis consumers. There are a lot of people who are in, minority groups that traditionally are not in favor of cannabis, but if it's something that's potentially, CBD, and it's for, a low risk, sort of health condition, if it's like sleeplessness, or you have, some mild anxiety, being a minority myself, I know that is enticing or intriguing to the minority population. There's a huge market share.
Yeah.
Right, especially in the GTA, or
Yeah, and older folks too, right?
Older folks as well.
It's like the not the easy entry point. People want it for therapeutic uses. They don't want to talk to their doctor about it. They also don't want to go to the cannabis store, because that's a different thing. Like this would serve that need in very intriguing and interesting ways, which we can talk, which I hope we'll talk about over the next 8-9 months and then beyond as well.
Yeah, it's definitely going to take time, though. I mean, by the time that the proposed regulations, it goes into the Canada Gazette, so that's sort of the process. It goes into Canada Gazette Part 1, and then once it gets approved, and goes through royal assent, then it'll get published in the Canada Gazette 2, and then that there's a whole process to this. So it's not like it's going to be even though the scientific advisory committee comes back with their feedback, it's not like it's going to go through quickly.
Right.
The proposed regs are going to kind of have to be consulted on as well.
Yeah, but within that time, maybe we get some things really right. Let's think about that.
Yeah. Hopefully, I think there's going to be some challenge definitely on the manufacturing side, for having producers being involved in this market as well. Because if Health Canada is really considering following the Food and Drugs Act, and that all considers GMP, and having that sort of standard that you normally have for drugs, then converting a facility to be able to fit that, to be able to manufacture that is potentially quite challenging. So the people who are able to actually manufacture it is a consideration, in terms of when is that going to be able to be rolled out, and then the store the store side, the store level of who's going to be selling it. I mean, that's also another consideration. So I mean, there's a lot.
It's a lot. No, it's not. It is none of that is simple. None of that is simple. None of it is quick. It has lots of implications and ramifications. But working back from like the end consumer, like it will be net benefit to them, even all the regs that are going to take to get it there and sort of the company supplying it. But thinking about it from the consumer back, I think there's lots of value in it, which I hope sort of is guiding the decision, but also there is demand for it. And so how do we get the demand to them? How do we supply that demand safely and as I guess as quickly as possible? And then who will do it and where it'll buy it and all those things.
Yeah, I mean, definitely, appreciating the small wins. Health Canada even recognizing this as a need and doing something about it, I think is huge. So yay. Yeah, exactly.
Well, Sherry, as always, I really appreciate the expertise that you're sharing with us today. Always appreciate the CannDelta view on these things, as always, as our official regulatory advisory partner for Business of Cannabis. So thank you. Have a good Monday, and we'll see you down the road.
Thanks, Jay.
Our work is made possible with the ongoing support of our official partners, including Cannabis at Work, Cannabis Benchmarks, CannDelta, Gallagher, and Torque & Mains.